Welcome to our channel. If you want to relieve sciatica pain and improve your mobility, follow these quick and effective steps. Step 1. Apply ice to the affected area for 15 to 20 minutes several times daily during the first few days to reduce inflammation. Step 2. After the first 48 hours, use heat therapy with warm compresses or a heating pad to relax muscles and improve blood flow. Step 3. Stay active with gentle movement like short walks, avoiding prolonged sitting or bed rest, which can worsen symptoms. Step 4. Practice gentle stretches specifically for sciatica, like the knee to chest stretch, piriformis stretch, and spinal twist. Step 5. Take over the counter anti inflammatory medications like ibuprofen, as directed to reduce pain and inflammation. Step 6. Maintain good posture when sitting and standing to reduce pressure on the sciatic nerve. Step 7. Try sleeping with a pillow between your knees if lying on your side, or under your knees if on your back. Step 8. Consult a healthcare provider or physical therapist if pain persists beyond a week or worsens, as you may need additional treatment or imaging. Don't forget to like this video and subscribe to our channel.